Welcome back. My next guest is Lisa Sather, a pharmacist with Mountain Pacific here in Helena. Thanks for joining us, Lisa.
Thank you, Janet.
So I want to start off with asking you about the opioid epidemic and how it really became a nationwide crisis.
Sure. The opioid epidemic is a dramatic increase in prescription drug abuse and overdose deaths that we have noticed between 1999 and 2016. And really, it's important to note that although opioids do have important medical uses, they definitely have adverse effects. They bind to the receptors in the brain that can cause a feeling of euphoria, well-being. That's the reward center in the brain. And in susceptible individuals, this can lead to an increased risk of opioid use disorder, addiction, substance use, misuse, and even serious consequences like overdose.
So why are opioids so addictive?
Right. So opioids, as I mentioned, they bind to the opioid receptors in the brain and increase the levels of a chemical neurotransmitter called dopamine. In folks, again, it's important to mention that are susceptible individuals, and some folks are not necessarily susceptible to addiction or dependence, but in susceptible individuals, this can lead to wanting to use more and more of a drug at any given time to create the same effects, and that can lead to addiction.
Okay. And I heard you say this, but I've heard it frequently, the terms dependence and addiction.
Sure.
Do they mean the same thing, or are they two totally different things?
So that's a great question. They are not exactly the same thing. So addiction basically means the continued use of a substance over time despite negative consequences. And this can have both physiological and psychological components. And so the physical kind of components of that, or excuse me, the psychological components of that would be things like uncontrollable craving, compulsive use, inability to discontinue when you feel like you need to. And then the dependence part of it is actually the physical side of that. So dependence basically means, you know, your body becomes accustomed to it over time. And there are two components to dependence, and that would be tolerance, meaning you have to use more and more in order to produce the same effect. And then withdrawal, you would note if you abruptly stop taking the medication. So dependence is a component of addiction.
Okay, so that's a really good distinction, so thank you for making that. So we've heard a lot about the epidemic, but now we're starting to hear a lot about reducing the opioid distribution or usage. Can you talk a little bit about that trend now?
Absolutely. So on the heels of the increased use of prescription drugs, misuse of those, overdose deaths that we've noticed in this period of time, we've had a lot of guidance that's come along the way. In 2016, the Centers for Disease Control actually released a new prescribing guideline to help providers in the community prescribe appropriately, more safely, more effectively for patients for chronic pain. It's important to mention this isn't relative to those who are treating cancer pain. It's really chronic, non-malignant pain. As part of that, what we have seen is a reduction in dosages that are being used, a reduction in duration of prescriptions, typically 3 to 7 days for an acute injury, because we know that longer-term use is associated with a greater risk of opioid misuse and substance use disorders.
Okay, so are there actually unintended consequences to the actual decreasing or the reduction of the use of opioids?
Yes, absolutely. You know, we're starting to see those now. So as a result of more prudent prescribing of opioids, we are seeing an increase in heroin overdoses. So because prescription opioids have become now less readily available to folks, we are seeing a transition to heroin. It sometimes can be cheaper to buy on the street. We've also seen an increase in suicides. And so that is an important thing to keep an eye on, because a lot of those folks who have chronic pain, terminal illness, severe medical conditions, you know, there are a percentage of those who have had narcotic painkillers in their system. And so it's two things to definitely we're monitoring.
Wow, that's a really difficult dilemma.
Yes.
So if there is a person who is on opioids and they want to get off or reduce, what advice would you have for them to do that?
Yeah, it's always a risk-benefit conversation that you would like to have with your provider. And so there are certain tapering schedules. Providers can work with you on that in order to discontinue the dose over a period of time to help you avoid uncomfortable side effects or withdrawal symptoms. So that's important to talk to your doctor.
Okay. And so with the opioid use disorder, what are some of the medications that can be used to treat it?
Sure. So for the actual opioid use disorder, there are prescription medications to use, useful to treat those. They are actually opioid in nature in some respects. Suboxone is one that is available for specially qualified providers to prescribe methadone in special treatment centers. Vivitrol is another one that's an injectable medication. So there are several out there. If you're diagnosed with that condition, you can receive medications to treat that.
Okay. And just real quickly, I have one other question. For folks who have overdosed, or if there's
Yes.
those situations of that, is there a medication that can be used to treat that?
Yes, that medication is called naloxone, or Narcan brand name, and it is useful in the accidental overdose of narcotics, either unintentional or intentional, and it actually helps to reverse the respiratory depression associated with that can be lethal and cause death. It's very short acting, lasts for about 30 to 90 minutes. Important to get folks to an emergency room or call 911 if it has to be administered. Montana actually has a standing order for it now. You can talk to your pharmacy about that.
Perfect. Thanks so much for the great information, Lisa.
Absolutely.
Well, that's it for this week. I want to thank Lisa Sather, Eric Sell, and Dr. Steele. I'd also like to invite you at home to tune in next week. Until then, stay fit, stay well, and stay healthy for life with Healthy Living for Life.
Healthy Living for Life is brought to you by Mountain Pacific Quality Health. We'd love to hear from you. If you have suggestions for future programs, visit our website at mpqhf.org or call us at 406-443-4020. You can also catch us on YouTube by visiting our website and clicking on the YouTube icon. Special thanks to Fire Tower Coffee House and Roasters. Production facilities provided by Video Express Productions.